So I just want to give you a few of the shocking statistics about the situation of mental health here in Hong Kong, which explain really why we're here today. Let me start by saying that everybody has mental health, in the same way that everybody has physical health. But did you know that 1 in 6 of you in Hong Kong have a mental health issue, or will have a mental health issue in your lifetime? Only 26% of you will seek help for that problem. In Hong Kong, right now, there are about 1.7 million people experiencing mental health issues. Prevalence in the financial services industry, the legal industry, in aviation, in engineering, i.e. there are certain predispositions to this condition. But did you also know that Hong Kong has more than 300 psychiatrists, is more than 300 psychiatrists short of meeting the minimum World Health Organization standard for a high-income country? And it will take more than 10 years, if ever such commitment were made, to try to make up that gap. What that translates to is a waiting time in the government hospitals of 3 years before you get an appointment for mental health issues. Your appointment time after 3 years would be roughly 9 to 11 minutes. And if you thought you were all okay because you've probably all got private health insurance, most of you may or may not know your insurances, bar one, do not cover mental health issues. And if you thought that maybe your insurance might cover acute mental health issues or psychiatric treatment should matters get worse, then you may be quite shocked to know that amongst the private hospitals in Hong Kong, there are no psychiatric inpatient treatments available. None, not one. So the big hope was that the new Gleneagles in Shushan Hill near Ocean Park was going to be the first to provide psychiatric treatment, residential psychiatric treatment, and the announcement was made this week that that is not currently happening. So Dr. Lucy Lord, who's the chair of Mind Hong Kong, is currently asking the whole nation to get behind the movement to try to radically get the government to make some radical changes in this respect. Lucy last night made a plea. She made a plea to the lawyers for help with writing such letters, and if there's anyone here who thinks they might be able to help Lucy, then please do let us know. So let's turn to the business impact. Most of us here are in business, or our partners are in business. 50% of the long-term absence of non-manual workers is accounted for by stress. One of our partners reports a 50% increase last year alone in its insurance premium, thought to be due to mental health, but they can't quite quantify it. The reason being is people don't acknowledge their mental health issues when they go to the doctor. It will be reported as something else, or they just don't go to the doctor. The clear message here, other than don't get sick in Hong Kong, is that, as always, prevention is better than cure. We've got plenty of charities in Hong Kong, such as Mind, ventures such as the City Mental Health Association, all working to ensure that mental health is recognised as a boardroom issue in corporates. And it's essential to maximise business performance and mitigate the risk by managing the mental health of your employees. So Shared Value Project, who are we? We actually believe that businesses can and must take a leading role in building the wave of change in society to make mental health a subject that everybody can talk about and deal with. Shared Value Project Hong Kong work with large corporates to leverage their core competency, which can include money, to address the complex social issue as part of their business strategy, not as charity, not as philanthropy, because they, at the end of the day, can be taken away. And we must find a sustainable solution, which means it must be a profitable solution. The good news is the Hong Kong government believes this too, and